I am pleased to report that over the last 24 hours, three patients who had been diagnosed as positive have been released from our facilities, having turned negative. However, in the same 24 hours, we have tested 696 samples, out of which 14 people have tested positive for the disease. 12 of the 14 are Kenyans, while 2 are foreign nationals. Of the 4 cases, four cases have a recent history of travel from Tanzania, South Africa, UAE, and the United States. 4 of them are from quarantine facilities, while 10 were picked by our surveillance teams. This now brings the total number of those who have tested positive for the disease in Kenya to 172. The 14 people that I mentioned have already been moved to isolation facilities, and contact tracing has begun earnestly. Let me just say this, that my friends, fellow Kenyans, let us brace ourselves for bad news. Let us be ready, because all the measures that we are going to take will not stop the disease abruptly. It is already here with us. There are 2 things that are fortunate for us. One is that the disease that Kenyans are getting is very mild. We have been getting very mild infections, and I'm going to ask Dr. Amos to say a little bit about that. As you can tell, the mortality rate for us has been quite low. But this is no reason for us to be relaxed at all. As we said earlier, we are praying and hoping for the best. But clearly, we must also prepare for the worst. And mentally, we must prepare ourselves to face an insurmountable situation. We must all work together. As I said last week, we are akin to a boat that is sailing towards a massive storm. And we must brace ourselves and be ready mentally. When you go to quarantine, it is very challenging. It is mentally straining. And we are having issues with people who are in quarantine facilities. It is not convenient at all. And my apologies to them for all the inconveniences that they are going through. But it is necessary. So, my fellow Kenyans, we must brace ourselves, mentally be prepared to face a situation that we haven't faced before. But I also know another thing. I know that we will pull through. I know that we are working together. I have seen effort from quarters that we would never expect. I have seen support from all over. And I have seen people helping each other. That is the way we are going to overcome it. We have now, out of the 14 people that I mentioned, for instance, 7 are from Nairobi. Mombasa has 2 new ones. Machakos has 1. Kisii has 1. Kiambu has 1. And Mandera has 2 cases. And the 2 reported cases from Mandera is a recent travel from Mombasa County. That explains why the decision by the president was taken yesterday to close some of the areas where we feel people moving into and out of are causing further spread of the virus. With regard to contact tracing, a total of 1,928, and by now nearly 2,000 persons have been monitored. We have increased our capacity and our ability to monitor these persons and trace these people. Out of those, 1,415 have been discharged, having tested negative, and 513 are currently on follow-up. To date, we have managed to test nearly 5,000 people.